I think we see life insurance, Janet, as a bridge, as a way to make sure you reach your destination of retirement. Oftentimes, once you get there, there's probably not, if you have followed the plan and the plan is in place, there's probably not a lot of need for a death benefit in the form of a life insurance policy, unless you just want it. Many of our clients do just want to pass that on to the next generation, and that's great. The need, though, the risk that is really more evident, and I call it the elephant in the room when I talk about it with my clients, is the risk of long-term care. We just spent 12 minutes and 40 seconds talking about Medicare. Guess what Medicare does not cover?
Long-term care. Yeah, absolutely. And it really is a tremendous risk. Basically, your odds are 50-50 that you're going to need it. So if you look at a husband and wife and you go, well, that's half of you too. you know? Yeah. So one of you probably is and one of you probably isn't. Now, statistically, that's how it works out. It might be that both people in that couple need it, and it might be that only one does. We don't know. What we do know is it is a tremendous risk because, as Scott talked about earlier in the show, let's say that a couple needs to have $6,000 a month in income for their cash flow needs every month. So they need to have that, and then along comes a medical need to the point that one of them needs to have care. And when we talk about long-term care, most people think about in a facility, whether it's in a facility or at home, there is cost there. And sometimes, frankly, it is more costly to stay at home than it is to be in a facility, depending on the level of care that you need. But regardless, in this scenario, let's play this out. The couple needed $6,000, and now an individual needs $6,000. Well, if the plan was good for the couple, we now need basically $12,000 to maintain the standard of living for the person who doesn't need care and then to get care for the other person. That'll blow up anybody's financial plan to double the need of income at some point along the line. And, for some people, they don't ever need that level of care. They need a lesser amount. They need fewer things done for them at home, not maybe as high of a professional level. But the point is, even if it's $3,000, that's 50% more income than we had planned for. And Tony, that's the reason that we see a need for long-term care. Let's talk about how some people might qualify. Like, what are some of the activities of daily living, the ways that they qualify to actually need to use the policy?
Yeah, to get to qualify for long-term care, so you're going to need to not be able to perform 2 of the 6 activities of daily living, which is bathing, transferring, continence, dressing, toileting, and eating. So just 2 of those. It's not that's not a lot of problems to go wrong. And long-term care is definitely an underused insurance product that it's a lot easier to plan to pay for that policy than to plan to pay for the costs that come with it.
Want more content like this delivered to your inbox weekly? Visit fastest4.com to learn more.